Hello viewers. Welcome to my channel. My name is Friedman Praise Melody. And on this channel today we will be talking on the topic hypotension. So it will be good you watch this video to the end to get every bit of this information. Please do well to like and subscribe to my channel. Hypotension. Hypotension, or low blood pressure, is when your blood pressure is much lower than expected. It can happen either as a condition on its own or as a symptom of a wide range of conditions. It may not cause symptoms. But when it does, you may need medical attention. Low blood pressure is generally considered a blood pressure reading lower than 90 mm of mercury for the top number, systolic, or 60 mm Hg for the bottom number, diastolic. What's considered low blood pressure for one person might be okay for someone else. Low blood pressure might cause no noticeable symptoms, or it might cause dizziness and fainting. Sometimes, low blood pressure can be life-threatening. Types of low blood pressure. Hypotension has two definitions. Absolute hypotension, your resting blood pressure is below 90/60ths of a millimeter of mercury. Orthostatic hypotension, your blood pressure stays low for longer than 3 minutes after you stand up from a sitting position. It's normal for your blood pressure to drop briefly when you change positions, but not for that long. The drop must be 20 mm of mercury or more for your systolic top pressure and 10 mm of mercury or more for your diastolic bottom pressure. Another name for this is postural hypotension because it happens with changes in posture. Measuring blood pressure involves two numbers, systolic top number, this is the pressure on your arteries each time your heart beats. Diastolic bottom number, this is how much pressure your arteries are under between heartbeats. Hypotension can affect people of any age and background, depending on why it happens. However, it's more likely to cause symptoms in people over 50, especially orthostatic hypotension. It can also happen, with no symptoms, to people who are very physically active, which is more common in younger people. Symptoms. For people with symptoms, the effects depend on why hypotension is happening, how fast it develops, and what caused it. Slow decreases in blood pressure happen normally, so hypotension becomes more common as people get older. Fast decreases in blood pressure can mean certain parts of your body aren't getting enough blood flow. That can have effects that are unpleasant, disruptive, or even dangerous. Usually, your body can automatically control your blood pressure and keep it from dropping too much. If it starts to drop, your body tries to make up for that, either by speeding up your heart rate or constricting blood vessels to make them narrower. Symptoms of hypotension happen when your body can't offset the drop in blood pressure. For some people, low blood pressure can signal an underlying problem, especially when it drops suddenly or is accompanied by signs and symptoms such as dizziness or lightheadedness, fainting, syncope, lack of concentration, blurred vision, nausea, cold, clammy or pale skin, rapid or shallow breathing, fatigue, depression, thirst. What causes low blood pressure? Some medical conditions can cause low blood pressure. These include pregnancy. Because a woman's circulatory system expands rapidly during pregnancy, blood pressure is likely to drop. This is normal, and blood pressure usually returns to your pre-pregnancy level after you've given birth. Heart problems. Some heart conditions that can lead to low blood pressure include extremely low heart rate, bradycardia, heart valve problems, heart attack, and heart failure. These conditions may cause low blood pressure because they prevent your body from being able to circulate enough blood. Endocrine problems. Thyroid conditions, such as parathyroid disease, adrenal insufficiency, Addison's disease, low blood sugar, hypoglycemia, and, in some cases, diabetes can trigger low blood pressure. Dehydration. When you become dehydrated, your body loses more water than it takes in. Even mild dehydration can cause weakness, dizziness, and fatigue. Fever, vomiting, severe diarrhea, overuse of diuretics, and strenuous exercise can all lead to dehydration. Far more serious is hypovolemic shock, a life-threatening complication of dehydration. It occurs when low blood volume causes a sudden drop in blood pressure and a reduction in the amount of oxygen reaching your tissues. If untreated, severe hypovolemic shock can cause death within a few minutes or hours. Blood loss. Losing a lot of blood from a major injury or internal bleeding reduces the amount of blood in your body, leading to a severe drop in blood pressure. Severe infection, septicemia. Septicemia can happen when an infection in the body enters the bloodstream. This condition can lead to a life-threatening drop in blood pressure called septic shock. Severe allergic reaction, anaphylaxis. Anaphylaxis is a severe and potentially life-threatening allergic reaction. Common triggers of anaphylaxis include foods, certain medications, insect venoms, and latex. Anaphylaxis can cause breathing problems, hives, itching, a swollen throat, and a drop in blood pressure. Lack of nutrients in your diet. A lack of the vitamins B12 and folate can cause a condition in which your body doesn't produce enough red blood cells, anemia, causing low blood pressure. Orthostatic hypotension. This happens when you stand up too quickly and your body can't compensate with more blood flow to your brain. Central nervous system diseases. Conditions like Parkinson's disease can affect how your nervous system controls your blood pressure. People with these conditions may feel the effects of low blood pressure after eating because the digestive systems use more blood as they digest food. Life-threatening conditions. These conditions include irregular heart rhythms, arrhythmias, pulmonary embolism, heart attacks, and collapsed lung. Medications that can cause low blood pressure. Some medications you may take can also cause low blood pressure, including diuretics, water pills, such as furosemide, Lasix, and hydrochlorothiazide, microzide, Orotic. Alpha blockers, such as prazosin, Minipress, and labetalol. Beta blockers, such as atenolol, tenormin, propanolol, Inderal, Inopran XL, others, and timolol. Drugs for Parkinson's disease, such as pramipexole, Mirapex, or those containing levodopa. Certain types of antidepressants, tricyclic antidepressants, including doxepin, Cylnor, imipramine, tofranol, protriptyline, Vivactal, and trimipramine, Simontal, sildenafil, Viagra, or tadalafil, Cialis, particularly in combination with the heart medication nitroglycerin. Treatments and drugs. Low blood pressure that either doesn't cause signs or symptoms or causes only mild symptoms, such as brief episodes of dizziness when standing, rarely requires treatment. If you have symptoms, the most appropriate treatment depends on the underlying cause, and doctors usually try to address the primary health problem, dehydration, heart failure, diabetes, or hypothyroidism, for example, rather than the low blood pressure itself. When low blood pressure is caused by medications, treatment usually involves changing the dose of the medication or stopping it entirely. If it's not clear what's causing low blood pressure or no effective treatment exists, the goal is to raise your blood pressure and reduce signs and symptoms. Depending on your age, health status, and the type of low blood pressure you have, you can do this in several ways. Use more salt. Experts usually recommend limiting the amount of salt in your diet because sodium can raise blood pressure, sometimes dramatically. For people with low blood pressure, that can be a good thing. But because excess sodium can lead to heart failure, especially in older adults, it's important to check with your doctor before increasing the salt in your diet. Drink more water. Although nearly everyone can benefit from drinking enough water, this is especially true if you have low blood pressure. Fluids increase blood volume and help prevent dehydration, both of which are important in treating hypotension. Wear compression stockings. The same elastic stockings commonly used to relieve the pain and swelling of varicose veins may help reduce the pooling of blood in your legs. Medications. Several medications, either used alone or together, can be used to treat low blood pressure that occurs when you stand up, orthostatic hypotension. For example, the drug fludrocortisone is often used to treat this form of low blood pressure. This drug helps boost your blood volume, which raises blood pressure. Doctors often use the drug midodrine, Orvatin, to raise standing blood pressure levels in people with chronic orthostatic hypotension. It works by restricting the ability of your blood vessels to expand, which raises blood pressure. Lifestyle and home remedies. Depending on the reason for your low blood pressure, you may be able to take certain steps to help reduce or even prevent symptoms. Some suggestions include: drink more water, less alcohol. Alcohol is dehydrating and can lower blood pressure, even if you drink in moderation. Water, on the other hand, combats dehydration and increases blood volume. Follow a healthy diet. Get all the nutrients you need for good health by focusing on a variety of foods, including whole grains, fruits, vegetables, and lean chicken and fish. If your doctor suggests using more salt but you don't like a lot of salt on your food, try using natural soy sauce or adding dry soup mixes to dips and dressings. Go slowly when changing body positions. You may be able to reduce the dizziness and lightheadedness that occur with low blood pressure on standing by taking it easy when you move from a prone to a standing position. Before getting out of bed in the morning, breathe deeply for a few minutes and then slowly sit up before standing. Sleeping with the head of your bed slightly elevated also can help fight the effects of gravity. If you begin to get symptoms while standing, cross your thighs in a scissors fashion and squeeze, or put one foot on a ledge or chair and lean as far forward as possible. These maneuvers encourage blood to flow from your legs to your heart. Eat small, low-carb meals. To help prevent blood pressure from dropping sharply after meals, eat small portions several times a day and limit high-carbohydrate foods such as potatoes, rice, pasta and bread. Your doctor also may recommend drinking caffeinated coffee or tea with meals to temporarily raise blood pressure. But because caffeine can cause other problems, check with your doctor before drinking more caffeinated beverage. Don't forget to like and subscribe to my channel if you find this video helpful.